succession to the videos what I've been taking up nowadays in gynecology, and in succession to those videos, today's video I'll be mainly focusing upon a very important and a concerning medical condition which is called as dyspareunia. So basically in this video we'll be understanding as to what is this dyspareunia and what are the causes, what are the symptoms, and how doctors are going to manage dyspareunia. So without wasting time, let's begin with the video. So sexual intercourse process, it might be a very pleasurable act for many, but there are certain individuals, there are certain couples who do experience a painful intercourse. That is, during the process of penetration, they may have pain, and even once the process is completed, the pain may persist in certain individuals and certain females. So, such a situation where before the act of sexual intercourse, either during the act of sexual intercourse or after the cessation of the process of sexual intercourse, if there is pain which is persistent and it is very troublesome to bear, so such a situation, the medical condition is called as dyspareunia. Although during a normal casual sexual intercourse process, there is always some sort of a pain but is always associated with sex. But in certain situations, if this pain becomes unbearable and very much discomforting, and even if the pain is persisting for a much longer duration of time, then it's a matter really to worry about and which needs important concern. So, such a topic, such a thing, it is called as dyspareunia. So, this dyspareunia condition is nowadays a very common medical issue which is being most frequently found in most of the ladies of around the globe, and lakhs of women around the globe are globally affected with this medical condition of dyspareunia. So slight pain or moderate pain during a sexual process can be quite okay, but if this pain is little bit more tormenting, so it is actually a matter of great concern. So when looking at the causes of it, so in such a situation, the causes of dyspareunia can be understood it as that it can either be due to a certain kind of a physical condition, or it can be a certain situation where it is the person is having certain mental issues. It can be a mental condition, such as in cases of sexual abuse, violence, the person is having a guilty feeling in doing sex, or in certain situation the person is having an abusive relationship. So in such a situation, it is also it is having a mental concern, it is having a mental cause as well. Apart from this, the third important cause is can be either psychological as well. So however, this dyspareunia condition, that is the pain during the process of sexual intercourse, it is most frequently found either it can affect a male as well as a female, but the condition of dyspareunia, it is mostly associated with female individuals. Now, however, females, they are mostly having this condition of dyspareunia. So basically, during the process of sexual intercourse, it is their vagina, the clitoris, and the labia which is through which they are going to experience intense pain, and that is ultimately going to affect their sexual life. Apart from this, their relationships also suffer because of this. So however, dyspareunia, the treatment of dyspareunia is now readily available, and the person can lead a very happy and a healthy sexual life once the treatment is undertaken at the right time, and a healthy relationship, a healthy marriage can be sustained. So, but in certain situations, but if this condition of dyspareunia is being not treated, if this situation is not being treated properly, treated at the very right time, this can lead to serious conditions, serious medical conditions can arise out of it. And now we'll be slowly discussing that what are the symptoms, what are associated with that this dyspareunia condition, where the female is experiencing intense pain either before, during, or after the completion of the sexual intercourse. So slowly and gradually we'll be discussing about what are the such conditions, what are the symptoms, what they women mostly experience when they are affected by dyspareunia. So the first important symptom what can be looked as it is that is the painful penetration. So whenever during the act of sexual intercourse, if the penetration is having causing an intense pain, intense discomfort is there, so it's one of the most important condition of dyspareunia, or even in certain females if it is of a psychological origin, that just by even a thought of it or before getting into the actual procedure of penetration or sexual intercourse, the female is having pain. So such a situation, it is the most important symptom which is associated with dyspareunia. Moving on to the next symptom is that in either during the insertion of a tampon in the vagina. Apart from this, if the pain is going to the pain of the intercourse is persisting for a much longer period of time once the act has been completed, and apart from this, if there's a slight jerk during the sexual process, if there is certain kind of jerks what is there during thrustings of during the process of sexual intercourse, if there is thrusting and jerks if it is happening, so that is evoking certain kind of a pain in the vagina. So that is one of the very important symptoms what should be considered for dyspareunia. Apart from this, there can be certain kind of a burning sensation or an inflammation in the vaginal canal or the birth canal, and actually it is due to the this dyspareunia condition, where one very important symptom what can be looked upon is that there is a decreased lubrication of the vaginal canal. So if the vaginal canal is having a decreased lubrication, so that decreased lubrication is ultimately going to evoke such kind of a pain. So it can also result in certain kinds of itching during in the vagina, and actually it is the foreplay during the act of any sexual process before commencement, before starting with the sexual process, it is mostly a natural thing that the foreplay process begins initially. So once the foreplay process has actually started, what it evokes is it causes the release of estrogen through in the female, that the hormone estrogen becomes activated, and that hormone in turn activates the secretion, or the secretion which is responsible for the lubrication of vagina. So if the vagina is not being adequately lubricated before the act of sexual intercourse, that can again cause such kind of a pain. Apart from this, rarely some of the women who are having this condition of dyspareunia due to certain psychological issues, so they may experience none of the above symptoms what I've mentioned, but they do have certain kind of a intense feeling, certain kind of a numbness or certain kind of a intense thrilling sensation in the vaginal canal prior to or during the act of sexual intercourse. However, if such a situation happens, this it should not be feared. You must consult your doctor immediately. And apart from this, there are certain women who are postmenopausal or after menopause, if sex is being commenced, if the sexual intercourse process is happening. Apart from this, if there are breastfeeding mothers, so it has been mostly found in both these situations, whether it is a menopausal women or in breastfeeding mothers, it has been seen that the secretion of the estrogen from the ovaries is greatly diminished. So once the secretion of the estrogen is diminished, this ultimately causes decrease in the vaginal lubrication, and once the vagina is not properly lubricated, ultimately that can result in painful penetration during the act of sexual intercourse. So this were the few important causes. These are the few important symptoms what the females can experience during the act of sexual intercourse course if they are suffering from dyspareunia. Apart from this, there are certain medications what are responsible for causing dyspareunia, and while looking at the medications responsible for it, it is actually one of the few list of medications what I'll be discussing is the antidepressants. They play a major role. It has been found that the role of antidepressants is having certain kind of a deleterious effect, and it ultimately can be one of the causative agent for dyspareunia. Antihistaminic drugs are there, this birth control pills are there are certain sedatives and the medications what are used to treat high blood pressure. So such medications have also been implicated for causing dyspareunia. Apart from this, there are various other problems which is commonly associated with this painful intense pain during sexual intercourse. It is one of the most important cause that can be looked upon is the condition of vaginismus. So in this situation, vaginismus is the most common problem nowadays, and it has been found that in this process of vaginismus, if there is a fear during the act of sexual intercourse, if a woman is having certain kind of a fear, so that is ultimately causing the muscles of the vagina to contract and making the act of sexual intercourse painful. So the condition of vaginismus is also one of the very important cause for causing dyspareunia. Apart from this, if there is infection in the vagina, any kind of a yeast infection in the vagina that can evoke pain. If there is a yeast infection, that ultimately can cause pain during the process of sexual intercourse. Apart from this, if there is any kind of injury, or if there is any kind of an inflammation or burning sensation in the birth canal, so during in the process in the vagina, if there is any kind of an injury has happened to it during any kind of pelvic surgeries are there, or even in situations of tubectomy. So after tubectomy procedure has been carried out for the fertility, for this control of the pregnancies. So once the tubectomy procedure has been carried out, it actually it happens is that the size of the birth canal is going to increase. So once the size of the birth canal increases, so that leads to pain in the process of sexual intercourse. Apart from this, if this any kind of a swelling what is associated through urinary tract infection, or if there is a swelling in the sex organs in the areas around the private parts, so actually this can also be one of the factors responsible for dyspareunia. And if the sex organs are having certain kind of dermatological conditions or skin conditions such as eczema, if any kind of the skin lesions are there, dermatological conditions are there such as eczema, so these also predispose to dyspareunia. Apart from this, there can be infections of the cervix and vagina, and it can be also seen in cases of uterine fibroids. So this dyspareunia can be of basically two types. It can be a superficial dyspareunia, means during the act of sexual intercourse, either there is intense pain in the cervix and the vagina, and if it is a condition of deep dyspareunia, so there can be intense pain in the lower abdomen in the region where the uterus is present. So in such conditions of deep dyspareunia, there can be uterine fibroids which can be responsible for causing this deep dyspareunia, and the situation and the conditions of endometriosis as well. So endometriosis is a very it's a condition where the uterine tissues, they are going to outgrow in other areas of the reproductive tract such as in the fallopian tubes. So that also can be one of the predisposing factor for causing dyspareunia. Apart from this, if there is any kind of a cyst in the ovary, that can cause a painful sexual intercourse, and in conditions of ectopic pregnancy. Although dyspareunia is a common problem affecting most of the women, but the most important cause is the vaginal dryness and infection of the vaginal canal. So vaginal dryness is the most important predisposing factor which can be looked upon for the condition of dyspareunia, and that leads to actually when the birth canal is dry, when the vaginal canal is dry and is having certain kind of an infection, obviously the libido of the female is going to decline. So once the sexual desire, the libido will fall down, that is ultimately going to hamper the relationships with the spouse, and the healthy sexual relationship with the husband and the spouse is going to get affected. And that can ultimately lead its outcome in the form of difficulty in conceiving and difficulty in a conception of a baby. So pregnancy is also being affected just because of these conditions of dyspareunia. And once this has been treated at the right time, Such individuals can lead a happy, healthy sexual life with their partners, and they can conceive well. So, while looking at the treatment modalities, so once you are having certain kind of this kind of problems, if you are facing one of any of the symptoms what I have told, if any such situations you are finding, you must immediately consult your doctor, and you should tell about what things you are undergoing through, and the doctor will take necessary treatment modalities to cure this. So when looking at the management strategies, now when looking at the management, it's very important that the doctors or the surgeons, they are firstly going to do the pelvic examination. And this pelvic examination, when they are going to perform, either it can be the internal pelvic examination, that they'll be examining the interior of the birth canal, as well as the external pelvic examination they can go for. Apart from this, they'll ask you for an ultrasonography. The urine test they are going to go for, because the urine test is going to rule out certain kind of bacterial infections or yeast infections if they are present. So the doctor will certainly advise you for a urine test. Apart from this, there can be culture and swabs from the vaginal canal, from the birth canal, so they can go for certain kinds of a swab test, culture test for bacteria and yeast infection. And there are certain medications what are going to cause relief. So in painful situations, there are certain suppositories which are supposed to be kept inside the vagina to provide instant pain relief. So there are certain medications which can be prescribed by your doctor. So actually, in whether if it is the postmenopausal women, so actually in the postmenopausal women and in the lactating mothers, it has been mostly found that the levels of estrogens decline, and once the level of estrogen has declined, that is ultimately going to cause to a decrease in the vaginal secretion. So since there is a decrease in the vaginal secretion, so such postmenopausal women, they need the hormone replacement therapy, and particularly estrogen is being supplied to them. These estrogen is being given to them, and that is directly being applied at the site. Apart from this, there is, when we look at it, there is nowadays there is a trend of providing the desensitization. There is a treatment modality which is called as desensitization, and during the process of this desensitization, there are certain vaginal relaxation exercises which are being done to relax the muscles of the to relax the muscles which are involved in the process of sexual intercourse. And actually the muscles of the vagina, they could get relaxed, and they ultimately lead to a lesser painful intercourse. Apart from this, the doctors mostly they prescribe you certain jellies, certain ointments, certain lubricants. During the act of sexual intercourse, doctor prescribes certain lubricants which must be applied to such females who are having dyspareunia. And there are various many jellies in the form of KY jelly, the repellent. There are strongyloid jellies. These are all available for providing lubrication to the vaginal canal. Apart from this, patients, they are also given the sex therapy, and during the process of sex therapy, the importance of foreplay is being told to the couples actually. So the importance of foreplay, it's very important, just because the process during the process of foreplay, it is mostly seen that is going to stimulate the estrogen hormone. And once the estrogen hormone during the process of foreplay gets activated, gets released in the bloodstream, that is ultimately cause the natural lubrication of the vaginal canal. And they are taught how to talk to their partners, how to communicate to their partners, talk about the different sexual positions, and they need to talk about the sexual things, sexual talks they need to discuss with they can go for sexual talks even before indulging into such activities. And apart from this, there are certain behavioral changes what they need to behave in a behavioral changes behavior. They are taught that the behavior of the spouse should be little bit modified so that the other partner can get comfortable. And apart from this, if there is any kind of a vaginal yeast infection, so doctors, they mostly prescribe certain kind of antifungals. Apart from this, if there is certain kind of a bacterial infections, so bacterial infections or urinary tract infections are there which are predisposed to dyspareunia. So in such situations, antibiotics can be prescribed. And if there is any kind of a swelling in the vaginal region or in the private parts, the doctor mostly advises to go for a bath with a lukewarm water, so that is ultimately going to help out in, in subsiding the swelling which is associated with any such kind of infections. Apart from this, lifestyle modifications are there. A good quality lifestyle modifications can be carried out. The doctors mostly advise for this. A good quality lubricant can be used during the process of sexual intercourse, and such patients are allowed, such patients are asked to maintain proper hygiene of such their private parts, and to wear the undergarments. What they wear is to be a little bit loose. It should not be tightly fitting, so that it can more predispose to certain kind of infections. So such women, they are advised to maintain perfect hygiene of the private parts and to wear loose undergarments. And apart from this, they should be, if there is certain kind of a bacterial infection or a fungal infection, they should, if they are indulging into any kind of a sexual intercourse, so they must do it with certain protections such as condoms and lubricants. And apart from this, such women are advised to have plenty of water. So plenty of water, and consume fresh fruits and vegetables. And if such that which will be actually going to replenish them with all sorts of nutrients. So the, if any of the situations, if what I have told in this video, if you are going through, and if you still have certain problems, you are should 100% immediately consult your healthcare professional, consult your doctor, gynecologist. And students and viewers, this was a very short discussion where I've tried my level best to simplify the condition of dyspareunia, why the sexual act in certain individuals it is more painful as compared to certain other people. So if still you have any queries or comments, you're most welcome to comment me in the comment section. If you like this video, give this video a thumbs up. And students and viewers who are new to my channel and they haven't subscribed, subscribe. And don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.